So the third stage of labour is the final stage, and this is the birth of your placenta and your membranes. Now your placenta has been keeping your baby alive for the past 9 to 10 months, depending on how long baby has been in you, and this is attached to the inside of your uterine wall. Your placenta is actually attached to your placenta and membranes. Now obviously this isn't a real placenta, but hopefully it will give you an idea. This part of your placenta is attached to the inside of the uterine wall. You have your amniotic sac, and inside here is your baby, which is attached to the cord, and inside here is also your amniotic fluid. And this is completely sealed up in your pregnancy, and when your baby is born or your waters break, they open up that hole and your baby will come out. Now, as your baby is born, they will still be attached to their placenta. So as your baby comes out and comes up onto your chest, the cord will actually still be going out of them, up through and through the vagina, and still attached to your placenta. The third stage management will be done according to, again, your midwife or your doctor. If you are with a doctor, what they will tend to do is something called active management, and if you've had any intervention or pain relief, then active management will often be recommended for your third stage. What this means is that you'll be given an injection in your leg or your bum, and this will help to contract your uterus. And as it does this, your placenta will separate, and the doctor or midwife will then pull on the cord to deliver your placenta, membranes, and the cord. Before they do this, they will do something called cord clamping. And there's lots of talk at the moment about delayed cord clamping or optimal cord clamping, and this essentially means that they are waiting around 1 to 3 minutes after your baby is born before they clamp and cut the cord. Now, why would they do this? Well, we know that in pregnancy, your placenta and membranes obviously keep your baby alive, and so when they're born, about 1/3 of their blood volume is still in their placenta. So that 1 to 3 minutes allows as much blood as possible from the placenta to go back in through the cord and into your baby, and this just helps reduce things like neonatal anemia. Once the cord is clamped and cut, your doctor will then pull, or the midwife will pull on the cord, and this will come out in one go, and that can be anywhere from about 5 to 10 minutes after the birth. The other option you have is something called a physiological third stage, and this involves waiting until your uterus starts to contract on its own. The placenta will then detach from the inside of the uterine wall, and as you're getting more contractions, you push your placenta out naturally. So there are no drugs involved, and this can be anywhere from about 45 minutes to 60 minutes after the birth of your baby. So it depends on what kind of third stage you want, whether you've had any intervention, whether you've had any pain relief, whether you've got any risk factors for bleeding, but it's definitely something to talk to your care provider about as to which third stage management you'd like to have.